We are pleased to be welcoming you to Southmead Hospital in the near future for an elective caesarean section to deliver your baby. We have created this short film to support you through this process. We will show you what will happen on the day of the admission and the steps you can take after surgery to help you recover and get home as quickly as possible. Before you come into hospital to have your baby, you will be seen by an obstetrician in the antenatal clinic to decide on the timing of the birth and discuss the surgery in more detail. Some women preparing for a stay in hospital are screened for MRSA. You will have samples of blood taken to check for anemia and to confirm your blood type. You will be given some stockings to wear throughout your stay with us. These are designed to improve the blood flow in your legs and to reduce the risk of developing clots. You will be given some tablets with instructions to take before surgery. We will ask you not to eat anything for several hours before you come in for your delivery. Please follow these instructions carefully to avoid your delivery being delayed. On the morning of your surgery, take the tablets you have been given. Have a bath or shower and put on the stockings you were given in clinic. Don't put on any creams or lotions on your skin. Do not apply makeup and remove any nail varnish on at least one finger on each hand. You may wear a wedding band, but please leave all other jewellery at home. Bring your yellow notes and all your clothes and toiletries for you and your baby. In particular, please make sure you pack a dressing gown and slippers and a nappy and hat for your baby, and remember your camera too. When you arrive at hospital in the morning, you will be met by a midwife who will check through your paperwork and provide you with identity bracelets and a hospital gown and measure your blood pressure, heart rate and oxygen levels. It's our policy to repeatedly check key information with you, such as your name, date of birth and allergy status, to reduce the chance of errors being made. So don't worry if everyone seems to be asking you the same question over and over again. You will meet an anaesthetic doctor who will ask questions about your medical history and discuss the risks and benefits of the different types of anaesthetic available for your delivery. The obstetric doctor will confirm you have signed a consent form, are happy with the planned procedure and answer any questions you have for them. They will be able to tell you your position on the operating list and give you a rough idea about what time your procedure will take place, although unexpected events can sometimes delay things a little. We will work hard to keep you updated should any changes or delays happen during the day. When it's time for your caesarean, a member of the theatre team will come to collect you. Your partner will have been given theatre scrubs to wear. You should put on your dressing gown and slippers for the short walk to theatre. When you arrive in theatre, the team will introduce themselves and you will sit on the operating table with your partner in a chair nearby. There will be an anaesthetic assistant, a theatre scrub nurse and assistant in addition to the medical team. Although the theatre can feel busy, the staff are there to ensure the safety of you and your baby. Your details will be checked again and you will be asked to confirm the operation you're expecting, whilst routine monitoring is being set up. The anaesthetist will put a drip in your hand or arm using local anaesthetic to numb the skin first. The drip will be connected to fluid and also to a medicine to help keep your blood pressure stable during the anaesthetic. If you are having a spinal anaesthetic, the anaesthetist will need to do a small injection into your back. In order to do this, your position is really important. You will either be asked to sit up or to lie on your side. If you are sitting up, you need to put your chin on your chest, relax your shoulders and try to curl over your bump. If you are lying on your side, we'll ask you to bring your knees up to your bump as far as you can. This helps to open up the spaces between the bones in your back so that it's quicker and easier to do the anaesthetic. It's important that you stay very still whilst the injection is taking place. If you do need to move, just warn the anaesthetic doctor first. Some local anaesthetic will be put into the skin on your back, which might sting a little bit at first. From then on, you should just feel a sensation of pressure. If you feel anything else, such as shooting pains or tingling, just let the anaesthetic doctor know, but try to remain still. Once the anaesthetic is injected, your bottom will start to feel warm, your legs might tingle, and they'll start to feel really heavy. You will lie on your side and then onto your back with the table tilted to the left to take the weight of the baby off your body. It will feel very strange, but don't worry, you will be quite safe and supported. The anaesthetist will assess how high the numbness extends by spraying your body with a cold spray, We know that the same nerves that carry cold sensation also carry pain, so if you don't feel cold in an area, you won't feel pain either. The operation will only begin once the anaesthetic doctor is happy that the anaesthetic is working properly. A catheter will be inserted into your bladder to ensure it's empty. Your tummy will then be cleaned, ready for surgery. You may be aware of the cleaning solution being painted onto your skin. A drape will be placed over your body and a big screen will be put up so you won't be able to see the operation. A final safety check is then performed, during which the team will once again confirm your name, the operation, and whether you have any allergies. Then the procedure gets underway. Your anaesthetic doctor will be there to keep you updated on the progress of the birth, answer any questions you have, and reassure you if you feel anxious. You may be aware of the blood pressure cuff on your arm going up and down every minute until the baby is born. This just checks that the blood pressure remains stable. If you feel sick at any point, tell the anaesthetic doctor, as it's often an early sign that your blood pressure has dropped as a result of the anaesthetic. Your anaesthetist can do something to make you feel better. Once it's time for your baby to be delivered, you may feel pressure on your tummy, and then your baby will be born. We can drop the drapes if you like at this point, so that you can see the baby for the first time. It's not uncommon for newborns to be a little surprised by the speed of a caesarean delivery, so don't worry if your baby doesn't cry immediately. Unless there is a good reason not to, we aim to delay clamping of the umbilical cord for 1 minute to allow your baby to receive extra blood from the placenta. Your anaesthetic doctor will flatten the bed and give you some medication to help your uterus contract, which can sometimes make you feel a little flushed in the face. Once the umbilical cord has been clamped, the baby is taken by the midwife to a resuscitator to be dried off and wrapped in clean towels so they don't get cold. On the resuscitator, we will do an initial baby check, apply identification bands and give a vitamin K injection. The partner is welcome to attend the resuscitator and can trim the cord if they wish. Once this is completed, the baby will be taken around to mum. They will be weighed, which is a good opportunity for photos, have a nappy put on, and then placed skin to skin. Our aim is to be skin to skin within 5 minutes of birth. Skin to skin contact with your baby is encouraged as it keeps them warm and helps regulate their breathing. Your midwife will help you with this. If you find it difficult to hold your baby whilst lying flat, your partner can help you. The remainder of the operation will take about 30 minutes. You will still need to be monitored at this time, so your blood pressure will still be recorded at regular intervals and your heart rate and oxygen monitoring will stay put on. The wound is closed with stitches which are usually dissolvable but sometimes have to be removed. A dressing will then be applied to your tummy. At the end of the operation, you'll be transferred onto a hospital bed and given your baby to hold again, preferably skin to skin, as this promotes early feeding. We will then take you to the recovery room, where you will be closely monitored for the next few hours. No additional visitors are allowed in the theatre recovery. Please explain this to your relatives to avoid any disappointment. Between 2 and 6 hours after your operation, you will go to the postnatal ward. Gradually, your legs will start to regain sensation. You will be able to feed your baby however you choose. You will be given regular pain relief as the anaesthetic wears off, which are all safe to take whilst breastfeeding. Please tell us if you're experiencing any pain, nausea, or any other symptoms so that we can give you extra medication if you need it. Research indicates that the earlier you can get up and about and eat and drink, the quicker the recovery time will be and the lower the likelihood of complications. You will be encouraged to sit on the edge of the bed as soon as possible, and it's anticipated you'll be able to care for your baby independently. Your catheter will usually be removed around 12 hours after the baby's birth. The amount of urine you pass will then be measured to make sure you are emptying your bladder properly. During your stay in hospital, an anaesthetic doctor will aim to visit you to check you have recovered fully from the anaesthetic and answer any questions you may have. The midwives and midwifery assistants on the ward will give you help to get your baby feeding properly. Your baby will have routine health checks from a specially trained midwife or a paediatrician and a hearing test. Blood tests will be performed on you to check for low iron levels, and you may be offered iron tablets if the results are low. It will be recommended that you stay in hospital until you are well enough to be at home and your baby is doing well. This might be as early as the day after your caesarean, but some will need to stay a couple of nights in hospital. You may be advised to have injections of a medicine to thin your blood to help prevent deep vein thrombosis. If this is the case, we will teach you how to do this before you leave hospital. After you go home, your community midwife will visit you and will be able to give you further guidance on your recovery. Thank you for taking the time to watch this video. We hope it will help you feel better prepared for your caesarean section at Southmead Hospital, and we look forward to welcoming you on the day of your baby's birth.